Every day, I get a little bit stronger.
Type 1 diabetes is a disease in which a person's pancreas does not produce any insulin for their body, so it must be injected with an insulin pump on a regular basis. Marla Bennett is one of the many people not only living with the disease, but spreading awareness about it.
So one of the main reasons I raise awareness is because there's a lot of misunderstanding around the disease, and so few people really know what it is like to live with type 1.
Bella, Marla's daughter, best tries to explain how type 1 diabetes impacts her life.
I think that with living with diabetes is a lot different than living without diabetes, because you really have to be watching your activity levels and what you're eating, because it's really life or death. For example, my mom, if she doesn't eat a meal, she'll have a low blood sugar, which is basically when her glucose levels are too low, and she kind of goes unconscious.
Most people are left wondering how patients living with diabetes keep themselves from actually getting low blood sugar and keeping healthy.
So every 3 months I have blood work drawn, and my doctor checks my levels. While during those 3 months, what I do is I try to watch my carbohydrates, I give myself insulin via the insulin pump, and I work out.
To patients with diabetes, exercise lowers their blood glucose levels and increases the body's sensitivity to insulin. This is why Marla and many others choose to go work out.
So overall, I'm not different from other people, but one thing that makes me unique is that I have type 1 diabetes, which means that my pancreas does not make any insulin.
Like Marla said, patients dealing with diabetes are not at all unlike others, and understanding what the disease is and figuring out ways to help is appreciated greatly by many. And from Hempfield Happenings, I'm Ava Baer.